All right, we're back. This is Dr. Doug Farrago. This is Dr. Andrew Anderson, DO over at Boonesboro Direct Primary Care and on Forest Direct Primary Care. This is our 7th episode locally in the Forest, Boonesboro, Lynchburg area, discussing the COVID calamity, depending on how you want to look at things, because we're getting to some insane times. Here's the issue I'm having. There's a lot of pushback, which I understand. People's liberties and freedoms have been squeezed a little bit, which we get. And there is no right answer how we would have dealt with this. So, Dr. Anderson, I'm going to kick this over to you about Sweden. Sweden went total free, and what happened in Sweden?
Okay, so everybody was looking at Sweden because we're all looking for this like easy button with COVID, and something that they did which drew the eyes of everybody on the planet was they said, if you're at high risk, you need to lock down. Everybody else, go about your business. As per usual, they kept bars open and movie theaters and restaurants open, and there were a lot of good evidence in the beginning, or maybe some numbers that said, maybe that's the way to go. As we get further into this, we've been able to wash out some of the inconsistencies and things to level the statistical playing field. And so we started looking at it per capita. We started looking at it as far as they got the virus later than other parts of the country that they were being compared to, like the US. And once you level all of that, then as of the last week, their number per capita per day is worse than anybody, I think, on the planet. I think they're sitting at 6.2 people that die of coronavirus per day per capita versus the United States, which I think is sitting at like 4.11. They only have 11 million and change people in their whole country. We obviously have a lot more than that. And so once you balance all that out, it turns out that method that they were using to like partially quarantine folks isn't panning out. Unfortunately, I would really like to have all that stuff open again and not be worried about it. But
it's not going to be perfect. So imperfection is the key word. There is no perfect answer for this. It's a very contagious virus that, if it gets into the right situation, will spread very quickly. So indoors, in a church, people singing, very crowded, it will spread. Movie theater, very crowded, it will spread. Outdoors is better, we think. Little separation, airflow, as well as the UVA, UVB infrared light, that tends to kill it. It's a little better outside. But this sucker spreads. Anybody who thinks this is a hoax, listen, let me explain this to you. In early March, there was almost 100,000 people in this country reading the news about Italy, thinking, I wonder if that's going to come over here. Those 100,000 people are off the planet now. They were in this country and they're dead now. Okay, 100,000 people died in those 2 months in this country. So this is real. Okay, this is not a fake. It's a very virulent, strong, contagious virus. And luckily, we are in Central Virginia. We were not hit that bad. And I think that because of some of the things that were done, I'm giving credit to some of the people. Now, it is not perfect to shut everything down. We're learning that now. There's some people thinking, hey, listen, I'm young, I'm healthy, I have my business for 15 years, and you're shutting me down. I'm going to go out of business. I'd rather risk coronavirus. I get that. I think that's a fair question. So I don't think there's any perfect answer. There's a lot of animosity and hatred, but here we are in Central Virginia. We've now been eased up a little bit with 50%, I think, on certain things and restaurants and so forth. This is where the surge would happen again. I think we have to be careful. What's your thoughts on that?
Yeah, you look at other diseases when we didn't understand them, whether it was polio or HIV or Legionnaire's disease in the 70s. I mean, all these things, we look at it in hindsight 20 or so years later, and that's when we're experts on it. When we're in the midst of it, nobody knows 100%, and we're all doing our best. And there's a lot of really smart, very motivated people working on this. And so, I mean, we'll come away from this in years from now and be like, we should have done that differently. And we're glad we bet on that horse because that ended up taking us to the win.
Right,
But
the risk that people are in social media, which we've never seen 100 years ago, was no social media, and people ascribe malice to this thing. They actually try to blame people and think there was something, you know, uh, you know, deceitful behind the recommendations. Listen, Fauci, when he first came out, you can see the video saying masks do nothing, right? Which made no sense to me. And now we're finding the new CDC recommendations just came out basically saying, listen, social distancing is good. It will help. They said the surfaces issue may not be as big an issue as we thought. It may not hang around on surfaces. And we've talked about that here on different surfaces at different times. Now they're changing on that. What they're saying is masks are good. And there's another study showing that masks will cut down on 75% of the transmission. When this started, they were saying, you'll see Fauci's interview. He was like, well, it's a waste of time. Okay, it's not a waste of time. So now we're going to the second surge. Hopefully never happens. But I'm driving by Sheets and this thing's packed and no one's wearing a mask in there. And I don't know if that's a smart way to go. I think I'm telling my patients, go slow and be smart here. This is now where people are, getting a little cocky with their whiskey muscles and they're going out as tough guys and thinking this was fake or this is really minimal. And it's not. It spreads very quickly. It's like gasoline on a fire.
So this is a plug for a video that Tisha and I are working on at our office that we'll pump out here in a little bit. But we went through, and there's a lot of stuff from Harvard and Tulane University, where some immunologists and epidemiologists got together and made somewhat of a definitive list of how risky certain normal daily activities are. And we'll rank those for you, like low, medium, high risk. So eating outdoors is considered low risk. Eating inside considered moderate risk.
Yes, makes sense.
Going to the gym is moderate to high risk, depending on a few things. And so we'll kind of outline all those. And so just another video to be continued.
Yeah, absolutely. Listen, let's look at the logic behind this thing. Really, what they're saying is respiratory droplets at some point will spread this. You got one asymptomatic COVID-19 patient running on a treadmill, kicking it out at 8 miles per hour, trying to get his times up, and he's huffing and puffing. Dude, how is that not going to be a high risk? So I'm a very pro gym. I'm sad the Y's not open still, but the bottom line is, that's a high risk. You have anything indoor. If you look at the examples over that happened in South Korea with that church, or in Seattle as well with the choir, that's how these things. It's indoors, is really worse. A lot of people close together is worse, and you have asymptomatic people. Half the people are asymptomatic. Okay, so I think I mentioned that we've never had an RNA vaccine. That's not true. We've had RNA vaccines in the past, polios, and I made that mistake. However, this is comparable. A small part of it has a look to it of the HIV. It's not HIV in any way, but it has when you look to it, that ball and spikes you see, there's a kind of a protein or something. What the concern is, we've never had an HIV vaccine, and this one is. I'm not so sure, or that I would bet we're going to have one soon. What do you still think on that?
Yeah. So, I as far as things spreading, it's happening. You said people on the treadmill. One of the research pieces that came out a couple weeks, or maybe just a few days ago, is out of or I guess all the numbers from New York, where the specialists that were hit the most, and it all comes to whether or not they're in touch with asymptomatic patients. So if you want to guess, here's your chance before I give the grand reveal, but it's emergency room docs and it is ophthalmologists.
Yeah, so
which we weren't
expecting.
Yeah, it's because you're close and you don't know that the person could be sick because they're asymptomatic. The pulmonologists, the anesthesiologists, the hospitalists, the intensivists, they were much lower on the list because they know the risk that they're getting into and they're suited up accordingly. But with this stuff where we don't know if somebody is symptomatic, that's where the problems run into. So I thought that was an interesting tidbit.
No, it's cool. Listen, we're learning again, nobody is trying to trick anybody. No one was ever trying to lie. And well, I think the CCP, the Communist Chinese Party, lied a lot before. And that's how this thing got out of there. And that's a long story itself. However, in this country, we screwed up a few different things. The CDC said they had a test. They didn't have a test. It was a bad test and it put us behind. Second, the PPE, we didn't have enough PPE for everybody. We were not ready. Third, we let things go through New York very quickly, and that was a mistake. They're all congested. That's where everything on the East Coast basically spread through, and they've tracked that through New York City. So there's a lot of mistakes we made. Probably wouldn't make them again. I think my concern is, I'm optimistic this thing's going to burn out. I am. I'm not buying this media garbage of every time is a negative thing, we're going to get a new normal. I'm tired of the new normal. Okay. I don't think it's going to be a new normal. I think life will go back. We'll look back on this and say, okay, we got past it. I am tired of the negative headlines. I do think we'll get past it. We just have to be smart. I recommend people wear a mask for a while if they're going to go anywhere. Obviously, you can't eat with a mask, but just eat outside. And I recommend you be smart about that. I recommend you still be washing your hands and wearing a mask if you're in, until they say there's no more cases. And it may not be with a vaccine, and they're not going to be a cure that with a magic pill. But I would tell people that until this thing burns out, be smart about it.
I agree with the masks. We
Yeah.
just got to wear masks. We just kind of have to get used to it. And it's hard for some people because it can trip an anxiety episode. It can be hard with asthmatics. So there's a few special cases there.
It's just when you're in groups, well, maybe when you're in shopping, maybe when you're in a store, just be smart, because now we want to make sure in this Lynchburg, Forest, Boonesboro area that another surge doesn't happen because of one asymptomatic. Now you would think, well, what would one carrier do? Well, my medical partner in Maine that I worked with, and still my best friend for almost 25 years, he was talking about a nursing home where one, they don't have it bad in Maine, in central Maine, but one worker at a nursing home had it. And before they knew it, 17 nursing home patients now are positive. And that'll go up exponentially. We started this video saying the same thing. This thing spreads extremely fast, which is just bizarre. Now, are they all going to die? Hopefully not. Hopefully none of them die. But I would say that don't pretend that it's not contagious and it's not deadly. It is probably, again, I'm still going to that 1% number. And for those people, for those 100,000 that were here 2 months ago and their families, I'm extremely sad. I'm saddened that we question that. Now, moving forward on another topic, just quickly, just tell people out there, we both do direct primary care. It's a monthly fee. We both have the same price. It's $80 a month for one, $135 for a couple, $165 for a family. That's per month. Come in or don't come in, but there's no other fees. There's no office visit fees. There's no co-pays. Procedures are free. Labs are 90% cheaper. In the long run, you probably save money. That being said, Dr. Smith in Appomattox has closed his practice. We've tried to get the word out. I think they've called you, but we'll try to get a word out. Now, we're both taking patients. You can call the information at the end of this video with our office website and call us, and we're going to try to take some of those patients. I don't do chronic pain management. There's other doctors in town that do. I don't think you do as well, really, on an intense basis, and I think Dr. Smith's practice did have that. So we are screening to make sure people are going to the right place, but we will be open to taking patients. You are as well, correct?
Oh, absolutely. Yeah.
Well, let's end it there. Any thoughts? Any positive, optimistic thoughts coming from you, Dr. Anderson?
No, I mean, I like doing this every week or so.
Yeah.
It's good. It keeps my feet to the fire, just researching stuff. I've loved researching these things. I'm a little bit of a nerd with that stuff, like I think you are too, and just anything medical. So I advise our patients and anybody else to reach out to us if they have questions, because we're trying to stay up on it.
Yeah, I did have a few questions come by, and we'll have to hit them next time. Patients are emailing me, and that's fine. Listen, I get bombarded, and this is I'm not bothered by people showing me articles and stuff, but I mean, just because I live this stuff and medicine is my life, I'm getting bombarded. I've got to sift through all the crap and make sure that's pushed away and look at some of the real stuff. So I'm very cautious of what I'm saying. There's been doctors legitimately been slapped on the wrist for saying things they shouldn't be saying. This is real. This can kill you. Hopefully we're over the hump. I am very optimistic. This is my personal opinion that we in June, we're going to really start seeing this just be damped out without a vaccine. And hopefully by the end of summer, we'll never hear this thing for a long time. But that's my hope and prayer. I got to put it out there because I still believe we need to believe in this. And so let's hope we don't have to our videos in the future can be just talk about fun stuff, other medical topics.
Yeah, I look forward to it.
All right, man.
Stay healthy.
All right, we'll talk soon. See ya.
See ya.